Hello. For those that don't know me, my name's Faye, and I'm one of the student fourth year Dermal Clinicians over at Victoria University. And today I am going to be discussing duty of care and what to do when you have a clinical implication or any form of complication within clinic. So today we are going to be also delving into duty of care provided by a dermal clinician. Okay. So as a practicing dermal clinician, it is important that we obtain consent, a photographic consent form or photographic release, depending how you refer to it, a treatment consent, but also documented aftercare. Now, I will explain this a little bit more further on. It is the clinician's responsibility to ensure safe treatment has been conducted and maintained close contact in the instance of a treatment complication. That can be utilizing whichever media is preferred by the client, whether or not that be email or telephone SMS or email. When a treatment reaction or complication occurs, what do you do? Firstly, you don't panic. This activates your sympathetic nervous system, which can then actually cause you to freeze or to just completely panic. So what you need to do is you need to talk to your client to assess the visual presentation as well as addressing how that client is feeling. A sensation scale out of 10 can be helpful in the instance of being 1, I barely feel a thing, or 10 being the skin is feeling a lot of sensation. Other words, get this off of me. On a rating of 6 or above, have a cold compress or wet fibrella on standby, depending on the treatment that's been conducted, to be able to cool the area site. Next is looking at the skin and assessing, is there something else that can be done? This could be using an LED or external cooling if accessible. Either of these depending on what the complication is at hand, whether or not that be erythema or edema, or whether or not it be swelling. It's all dependent on that client and what they're showing. Once a client is comfortable, assess for home care. This may need to be at the discretion of a pharmacist if needed to acquire post-care such as Dermaid or Burnaid, so on and so forth. On the client leaving, it is the clinician's responsibility to document what happened in a detailed incident report that is attached to the client's file or as per that clinic's protocol. Some protocols require a manager or senior dermal clinician to see the client before leaving the clinic to assess. It is important to keep in touch with your client, especially post-incident. Stay in touch, whether or not that be email or telephone, depending that chosen media as mentioned before, but ensure your client is okay and how their treated area is progressing, whether or not it is worsening over time or whether or not it has started to calm down external of the clinic. Further treatments may be needed to intervention and reduce the development of issues such as post-inflammatory hyperpigmentation, this just being one of many examples. Now, in the instance that a client has not complied with the post-care recommendation, legally a waiver needs to be signed acknowledging that the individual has decided to not adhere to the post-care recommendation. It is crucial that this documentation is signed. In this instance, and the clinician may potentially need to refuse future treatment service due to not adhering to post-care. The reason for all the documentation mentioned is that in the instance of any further legal implications, that the clinician and the business are covered and have adhered to legal jurisdiction and supplied documentation of such accordingly. I will also just note before we conclude our video today that this waiver would best be signed at the end of that treatment to acknowledge that if they do not comply with the post-care treatment, that essentially is on the fault of that client, and at the discretion of that client, to also emphasize the importance of that post-care in order to reduce the risk of any form of post-care implications. Thank you for listening. Feel free to drop any further suggestions you have below in the comments. Otherwise, I hope this was helpful.